RN question discussion. My name is Vichita, NCLEX RN trainer at Athena Coaching Center. Here is the question. Registered nurse and LPN are working on the unit and client who is about to be discharged home with gastrostomy 2 feeds need care. Which responsibility should the RN delegate to LPN? Select all that apply. So what is the situation here? LPN as well as a registered nurse are working together in a unit where you have a patient that the patient is about to discharge at the point of discharge you have to give instructions regarding how to feed the patient and what are the care, how do we take care gastrostomy. Okay, so that means the patient is getting discharged with gastrostomy tube. And which responsibility should the RN delegate to LPN? What is delegation? Delegation is dividing activities or any kind of nursing duties according to the competency of a healthcare provider. So based on the competency of licensed practical nurse, the RN should delegate. So what all are the delegations or what all are the activities among this can be delegated to LPN? Select all that apply. Here you should remember what all are the responsibilities that can be performed by RN and what all are the responsibilities that can be performed by LPN. So you should know the job responsibilities by RN as well as licensed practical nurse. Completing nursing process, administering injections, giving education, these are the responsibilities by registered nurse. Whereas LPN can administer oral medication, LPN can complete all basic need of the patient. Even they can perform or they can assist a registered nurse, they can assist all the procedure, they can ambulate the patient, they can monitor the vitals, they can record each and everything what they normally perform. Okay, so these are the job responsibilities by RN as well as LPN. Now we'll read the option. Option 1 says cleaning the skin surrounding stomach. And option 2 says crushing and administering multivitamin through gastrostomy tube. Third says programming feeding pump to administer bolus feed. And number 4 says teaching the client about home enteral feeding and gastrostomy tube care. And fifth one is weighing the client using scale. Okay. So number 1 cleaning the stomach. Number 2 is crushing medications and administering the multivitamin tablets through gastrostomy tube itself. And third is programming the feeding pump. And fourth is teaching the client about home enteral feeding and weighing the client. Out of these 5 options or 5 actions are there. Among these 5 actions, which one can be delegated to licensed practical nurse? Okay, so you can select the answer. Here number 1 is cleaning the skin around the stomach. That can be performed. Okay, so cleaning that can be performed by LPN. So you can select this answer. Second is crushing and administering medications through gastrostomy. It will be always oral medications or a tablet form of medication. So that can be given by LPN. But if this is an injection should not be administered by licensed practical nurse. But oral medication definitely under supervision of registered nurse, they can administer. And third one is programming the feeding pump. It's like a setting a feeding pump. If anyone can set the feeding pump, if you know how to set this apparatus. Okay. So this can be done by LPN. And what 4 says, teaching the client about teaching. Teaching should not be done by LPN. Teaching and providing health education, assessing, instructing. All these are the action or the responsibility by registered nurse. So fourth one is wrong. Weighing the client using the scale. Yes, weighing can be performed by LPN. So what all are the answers? Option number 1, 2, 3 and fifth one. Whereas fourth one is wrong. Teaching should not be done by registered nurse. This is how you will answer the question which comes under select all that apply. So if you have any doubts, you can just drop your doubts in the chat box. Thank you for watching. God bless you all.